Hi, I'm Dr. Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to be talking about Lilly Ghalichi. She is a previous reality star. Some people know her from Shaws of Sunset, but she recently posted on her Instagram that she had filler injections underneath her eye, and she ended up almost getting necrosis of the skin in that area. She definitely probably had emboli of the filler into one of the arteries, the main arteries in the face, and it caused her skin to start changing color, turn darker. And I think it's an interesting thing to talk about because I always warn people about things, particularly non-invasive things, because they think they're not dangerous. And it really are, in the wrong hands, any of these treatments can be somewhat dangerous or scary. So you really want to make sure that you understand the risks of the procedures and what can happen. Again, it's fairly rare. Even in experienced hands, complications can happen, but there are ways to treat these things, and I want to go through those as well and what really happened to her. So in Lily's case, this is one of the classic ways that injection of filler into an artery will present. Patient will come in, they'll get an injection, they may look okay right away or immediately show signs, but in her case, it took a few hours. She noticed that her skin started changing color, it started looking mottled, it started looking a little darker, it may look a little red. These are all signs that something's happening, and in that case, it is sort of an emergency. You want to get this treated right away if you see this and you had fillers in your face, because it means that the filler went into an artery. And when it goes into an artery, the blood supply to that area of the face can become compromised and actually kill that skin. So in her case, she did notice that right away her skin was changing colors. She had a little filler put in her eye, her cheeks started changing color, turning dark, getting mottled. And she did the right thing. She called her doctor. She wasn't getting a great response, but she finally got a hold of some doctors that treated it. And the way that you treat something like that is trying to dissolve that filler. So what can you do? You want to increase blood flow to the skin in that area. So warm compresses, massaging that area, trying to break up the filler. There's also an enzyme you can inject into that area that will dissolve the filler called Hyaluronidase. And what it does is go in and actually help dissolve that filler. But again, you're going to have to massage it into that area because you don't know exactly where that blockage is. Thirdly, you can give aspirin, and what aspirin does is thin the blood, bring down the inflammation, try and get, again, increased blood flow to that area. One thing you can do if it's not helping and getting progressively worse is even hyperbaric oxygen or anything to try and increase oxygen and blood flow to that area in the face. And in her case, after a few hours and finding something to treat her, she was able to treat that embolism, and thank God she didn't get to necrosis. So they were able to reverse some of those signs and actually reverse the embolism that she had in her artery. So in Lily's case, she got lucky. She got treated right away, and she got there in time to save that part of her face. Some patients not quite as lucky. We are going to show some photos here of a patient that did have an infraorbital artery injected and didn't go in time to get some necrosis of the face. Not trying to scare anybody, I just want people to be aware that you do want to go somewhere that's experienced and know what to do if this were to happen to you. Another common area that you'll see is on the dorsum of the bridge here of the nose if they're doing a liquid rhinoplasty or fillers in the nose. And again, that can be a very tricky place to inject filler because it can connect through the web to the eye, it can kill part of the nose, it can kill part of the skin on the face. And then another really common area for people to inject is into the nasolabial folds. And there is an artery called the facial artery that runs up along the side of the face there. And if that artery is hit, again, big problems because it supplies a large area of the face. It can cause the whole side of the face here or even onto the bridge of the nose to, again, have those signs of necrosis or damage to the skin. So people want to be careful injecting into those areas and make sure your injector is experienced. One area that's less common is the lips because the lips are so vascular, but there is an artery that runs around the lips, the labial artery, other arteries that are down here. Again, injecting into the marionette lines or the lips. Want to be careful of these things because it can cause occlusion of those vessels. And I think the scariest of all is injections around the eyes. There's a lot of talk around the eyes because of blindness. So when we're injecting in those web of arteries around the eyes, there are interconnections from these outer arteries that go deep back into the eye, into the retina, called the retinal artery. And if somebody injects hard enough, they can actually shoot the filler in the back and block that artery that goes to the retina. And then what happens is blindness. Exceptionally rare, but it's something that people should be aware of. And that's why I always tell them go to an experienced injector. And the main thing I think to be taken out of this is not to be scared of fillers. I think done in experienced hands, these complications are exceedingly rare, but I think you should be aware of them. And then what can I do to prevent them? And there are a lot of things that have been developed, as we already know in this case, how to treat it if it happens. And if you see any of those warning signs, get help immediately because that's the most important thing. The quicker you get in there and dissolve it, the better chances you have of not having any long-term complications. How can you prevent it? Number one, right, is an experienced injector, an injector that knows their anatomy, their technique, they know where the blood vessels are, they know how to avoid these things. And then there's some other questions you want to ask, particularly around the eye, because of that retinal artery and not wanting to get any effects on the eye, is using blunt cannulas. So there's newer cannulas that aren't sharp needles that are blunt. So it's very hard for that blunt needle to get into an artery and cause that problem. So you want to ask your injector, what type of needle are you using? Are you using a sharp needle? Are you using a blunt cannula around the eye? Those things can help you. Secondly, how are they injecting? Are they pulling back before they inject? Which means you can test by the injector pulling back that it's not an artery, there isn't a flash of blood back, that it's safe to inject. Thirdly, how you inject. So when the injector is pushing in, instead of pushing on the way in, you push on the way out. So if you had hit an artery and you're injecting the way out, it's not going to go into the artery. Lastly is the amount of filler and type of filler you're using, right? These are thankfully dissolvable fillers. So if you did hit an artery, that some of these enzymes and things can dissolve it. A permanent filler in those areas can be much more dangerous because you can't dissolve it. Something to think about. And then lastly, on that same token with the filler is the amount you're injecting. Better to inject small amounts and little amounts in a giant big bolus of filler, again, because if you do little amounts and it does happen to have an artery, it'd be less dangerous than if a giant amount of filler was put in that artery. So I think a combination of all those things are just telling you that the experiencing injector is critically important in this for all of those reasons, because they have to be aware of these things as far as the technique and how to avoid complications. And then if one were to happen, how to treat it. So I think, again, exceedingly rare for something that happened to Lilly to happen to you, but just be aware of those things so you can avoid ending up having a problem like she had. Yeah, I want to close on the similar thing that I said in the beginning, which is, again, non-invasive doesn't necessarily mean non-dangerous. It just means that you have to go to somebody experienced. So if you go to somebody inexperienced, it can be very scary and dangerous because they can be inexperienced and overconfident and really not even know what potential complications they can create. Versus going to somebody very experienced, knows how to lower your risk, increase your benefits, and again, that's something you always want out of any cosmetic treatment you get, including fillers.
Okay, the only question is, it's pretty common to bruise after dermal fillers. So how do you differentiate between necrosis or an occlusion and traditional bruising?
Well, traditional bruising will pop up and usually be in a generally defined small area where you have that bruise, right? When you have necrosis and occlusion of the artery, what you're going to see is spreading. Like you're going to go home and there may be a bruise from your injection and it's kind of sitting there, but if you go home, you notice that it's spreading, that the skin's getting mottled and it's getting darker and it's starting to get a much larger area. That means something's going on, including that blood supply. It shouldn't be growing over the next couple hours or day, you know, or getting worse, progressively worse over those couple hours or days. So that's one telltale sign something is going on. You know, as it increases, obviously you're going to start to get pain, you're going to get redness, other things, but early on, that's one thing if you notice that it's starting to spread.